So we've got Bruins, we've got Trojans, we've got Wildcats, we've got Mustangs, we've got Tigers, Blue Jays, Irish, trees, we've got it all, but you know, that's in the past. I'd like you to join me in congratulating all of the new anteaters in the class of 2016. It's now my privilege to introduce the faculty member who will be administering the oath of medicine this evening. This is an honor that Dr. Clayman, the Dean, each year selects a faculty member to present the oath. And so this is a special event for Dr. Fritz Lynn. He's been a member of the faculty here at Irvine since 1990. During his career, Dr. Lynn has achieved high distinction as a scholar, a teacher, and an academic leader. Dr. Lynn has authored more than 75 publications, primarily in the area of cancer cytopathology. He has served as the residency program director in pathology and the fellowship director for the cytopathology program here at UCI. He's also been the chief of clinical pathology services and the director of the Human Tumor Tissue Bank at UCI Medical Center. Dr. Lynn is currently serving as the interim chair of the Department of Pathology, and his department's year 2 course in general and systemic pathology was recognized by the student body as the outstanding preclinical course for 2011-2012. It's my pleasure to introduce Dr. Fritz Lynn.
Thank you, Dr. Brisbane. Oops. I want to welcome you as students in the class of 2016. It is really an honor for me to participate in tonight's white coat ceremony. It is also an occasion when you are acquainted with the principles of Hippocratic Oath. The oath is one of the oldest binding documents in history. It is still held sacred by physicians to this day. Its principles are: treat the sick to the best of one's ability, preserve patient privacy, teach the secrets of medicine to the next generation, and so on. It is also strongly binds the students to his teachers and the greater community of physicians with responsibilities similar to that of a family member. The oath of Hippocrates has remained in Western civilization as an expression of ideal conduct for the physician. Today, most graduating medical school students swear to some form of the oath, usually a modernized version. Indeed, oath-taking in recent decades has risen to near uniformity, with just 24% of US medical schools administering the oath in 1928 to nearly 100% today. Tonight, the School of Medicine administers the medical student oath in its modern version to the class of 2016. To all incoming students, please repeat after I read a sentence or a phrase, but do not read together with me. So will all students of the class 2016 rise and raise your right hand, and please read after me, and when I raise my hand, you can read after I read the sentence or phrase here. Today, in the presence of family, friends, teachers, and colleagues, I dedicate myself to the profession of medicine.
I dedicate myself to the profession of medicine.
As a medical student, I dedicate myself to the service of humanity.
I dedicate myself to the service of humanity.
I will use my skills to care for all in need without bias and with openness of spirit.
I will use my skills to care for all in need without bias and with openness of spirit.
I vow to hold sacred the bond between doctors and patients.
I vow to hold sacred the bond between doctor and patient.
I will hold in confidence all that my patients entrust me.
I will hold in confidence all that my patients entrust to me.
I will strive to alleviate suffering.
I will strive to alleviate suffering.
I will respect the dignity and autonomy of my patients in living and dying.
I will respect the dignity and autonomy of my patients in living and dying.
As a medical student, I recognize my duty to society.
I recognize my duty to society.
I will work to promote health and prevent disease.
I will work to promote health and prevent disease.
I will advocate for the welfare of my community.
I will advocate for the welfare of my community.
I will acknowledge my limitations and my mistakes so that I may learn from them.
I will acknowledge my limitations and my mistakes so that I may learn from them.
To uphold these responsibilities, I will maintain my own well-being and the well-being of those close to me.
I will maintain my own well-being and the well-being of those close to me.
As a medical student, I will promote the integrity of the practice of medicine.
I will promote the integrity of the practice of medicine.
In the tradition of my chosen profession, I will honor all who teach me this art.
I will honor all who teach me this art.
Through honest and respectful collaboration with my colleagues, I will seek new knowledge, re-examine ideas and practices of the past, and teach what I have learned.
I will seek new knowledge, re-examine ideas and practices of the past, and teach what I have learned.
Above all, the health of my patients will be my first concern.
The health of my patients will be my first concern.
This oath I take freely and upon my honor.
This oath I take freely and upon my honor.
Thank you. Congratulations.
Okay, I want you to take a close look at those white coats. Pretty nice, huh? You see the embroidery on them, the blue inscription? That did not just magically appear on your coats. It is a gift to you from two very special friends of the School of Medicine. I'd like to recognize B and